Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Okay, so picture this. You head to the hospital, right? You're expecting to get better.
Of course.
But, and this is something that might make you think twice, infections that you can actually pick up in the hospital.
Oh, yeah.
They're a big problem.
They are.
And you know, one of the most common culprits,
Yeah. What is it?
it's a bacteria called Clostridium difficile.
Right.
And you often hear it just called C. diff, you know.
So that disc, yeah.
So new research is suggesting that this bug, and it is a troublesome one, that can cause really serious issues, even be, life-threatening.
Right.
It's way more common in hospitals than we thought.
Yeah, and it's interesting because for a long time, we thought it wasn't really spreading that much from patient to patient in the hospital.
Right.
But this new research is kind of showing us a more complex picture of how it actually moves around.
Totally. And this new study that we're diving into today, it really looked deep, really deep into exactly how C. diff travels within these intensive care units. Right.
Yeah.
And what's become pretty clear is that if you're only focusing on the patients that are actually getting sick,
Right.
you're probably missing a big chunk of how it's really spreading.
Right.
So think about it. How did these infections even happen?
Yeah.
Well, this study is telling us to look beyond just, simple patient-to-patient contact.
Right. So it begs the question, if it's not mainly from patient to patient, then where is it hiding, right?
Yeah,
And how's it moving around?
exactly.
That's the puzzle this research is trying to solve.
And that's our mission in this deep dive today.
Yep.
To unpack this research, try to figure out where it's hiding
Yeah.
in these, intense care environments. And then what does that mean for us? How do we keep patients safe?
Yeah, for sure.
So we've got a couple of sources today, a recent article from, the Health News that highlighted this study.
You okay?
And then the original research paper published in JAMA Network Open.
Right.
So let's unpack this. What was the main question the researchers were even trying to answer here?
So the main thing they were trying to figure out was how C. diff spreads in healthcare, and specifically in the ICU.
Okay.
So they looked at the role of environmental surfaces, think of bedside tables
Right.
or the nurse call button. And they also looked at the hands of healthcare personnel.
Yeah.
So really trying to uncover these subtle ways that the bacteria might be transmitted.
Okay, so how did they go about this? It sounds like a huge project.
Yeah, it was a pretty big study.
Okay.
So they did this 13-week longitudinal observational study back in 2018 in Utah.
Okay.
So they looked at 2 different ICUs over that time, and what they did was they collected data every day.
Wow. Every single day.
Every day, in every single room that was occupied by a patient.
That's a lot of work.
It is a lot of work.
What kind of things were they sampling?
Yeah. So they were sampling from a few different places. They would get samples from the patient, from the armpit, the groin, and the perianal area, or from stool if it was available.
Wow. Okay.
Then they went around the room and sampled surfaces that the patient touched, surfaces that the healthcare workers touched, and surfaces in the toilets.
Okay.
And then they would take samples from the hands or the gloves of the healthcare workers as they were leaving the room.
Okay.
And that was right before they did any hand hygiene.
Oh, wow.
And finally, they would sample shared environmental surfaces, like surfaces in the hallways of the ICU.
Okay, so that's comprehensive.
Mm-hmm.
Right. But how do you know that the C. diff that you're finding in all these different places
Right.
is even related? Is it part of the same, chain?
Right. So they used a very advanced technique for you called whole genome deoxyribonucleic acid sequencing,
Okay.
which is basically like a genetic blueprint of the bacteria.
Right.
It lets them see tiny differences in the DNA. These are called single nucleotide variants. So if they sequence the C. diff from a patient and then sequence it from a surface, and they see that those sequences are almost identical,
Oh, well,
then they can be pretty sure that those are related.
Okay, so it's almost like, aha, we found the culprit.
Exactly.
They can track it. This
Yeah.
came from this patient's bed, and now it's on this nurse's hand.
Right. And they even had a definition for what they called a transmission cluster,
Okay.
which is a group of isolates or samples that have 2 or fewer single nucleotide variants between them.
Wow.
So really closely related.
Okay.
And they weren't only looking at the type of C. diff that makes people sick.
Oh, okay.
They also included non-toxigenic C. diff, which doesn't produce toxins and is generally considered harmless.
Okay.
So it gives us a better understanding of how C. diff is moving around in general.
Gotcha. Okay, so they gathered all these samples, they did all this analysis, and what did they find?
Yeah, so some key findings here. First of all, nearly 8% of the patients had C. diff that was genetically linked to other patients who had been in the ICU.
Go.
So that's pretty significant.
Yeah.
But here's where it gets really interesting. When they looked at the environmental surfaces and the hands of healthcare personnel, they found that C. diff was moving around 3.6 times more than when they only looked at patients.
3.6 times more. That's huge.
It is huge.
So surfaces are playing a big role here.
Yeah, they're acting as reservoirs.
Okay.
Another interesting thing, over half of the potential transmission events they found involved patients who were never even in the hospital at the same time.
What? How is that possible?
So sometimes they were separated by wicks.
How?
Well, C. diff has these really tough spores that can survive on surfaces for a really long time.
Oh, wow.
And they're also resistant to a lot of our cleaning methods,
Really?
including alcohol-based hand sanitizers.
Oh, wow.
So C. diff from one patient could be on a surface and stay there for weeks, and then another patient could come along and pick it up.
Oh, that's kind of scary.
It's a little bit scary.
Okay, so you said they looked at both the kind that makes people sick, the toxigenic, and the kind that's harmless.
Right.
What'd they find there?
So most of the spread that they saw involved the harmless kind, the non-toxigenic.
Okay.
But the researchers think that this is a warning sign because if the harmless kind is moving around so much, it means the harmful kind could be doing the same thing.
Oh,
We just might not be picking it up because we're mostly focusing on the patients who get sick.
Right. Okay, that makes sense.
They found 7 transmission clusters involving 22 unique patients.
Okay.
And here's the crazy thing. Over 70% of these clusters would have been completely missed if they were only looking at the patients.
So the environmental sampling and the hand sampling were key.
It was absolutely crucial.
Wow. Okay, were they able to find any specific ways that this stuff was being transmitted?
Yeah, they found a few specific routes.
Okay.
So sometimes C. diff would move from the patient to the hands of the healthcare personnel. Right.
And then they would go to another patient's room.
Gotcha.
And they also saw C. diff moving from a patient to a surface in the room, which was then touched by another patient.
Right.
So that shows that both hands and the environment are really important.
Okay.
But one interesting thing is they didn't find much evidence that C. diff was sticking around in a room after it was cleaned.
Oh.
So very few of the linked cases seem to be because a patient was in the same room as a patient who had C. diff before them.
Okay, interesting. So what are the big takeaways here? I mean, how does this change the way we think about these infections?
Well, for a long time, we didn't think that transmission within the hospital was a major way that people got C. diff.
Okay.
But this study suggests that it might be way more common than we thought.
Okay.
So it really emphasizes the importance of the basics stuff, hand hygiene, and environmental decontamination.
It's amazing how important that stuff still is.
It's so important.
Yeah. And if even the harmless C. diff is spreading this much, it makes you wonder if the harmful C. diff is spreading in the same way.
Right.
And maybe we're just not detecting it.
So are you saying that the way we track these infections right now, it might not be enough?
It might not be giving us the full picture because right now we're mostly focused on patients who develop symptoms.
Right.
But if we also did environmental sampling and tracked transmission through healthcare personnel, we might find that it's spreading a lot more than we realize.
Okay, so were there any limitations to this study? Anything we should keep in mind?
Yeah, a few things. So remember we talked about how they included non-toxigenic C. diff?
Yeah.
Well, it's possible that the harmless kind spreads differently than the harmful kind.
Okay.
But the researchers say that it still gives us valuable information about how C. diff spreads in general.
Right.
Another thing is that they didn't sample the patients every single day. So it's hard to know for sure when a patient got C. diff, if it was already there when they arrived at the hospital, or if they picked it up during their stay.
Gotcha.
And they also only took samples from the healthcare personnel's hands right before they cleaned them.
Right.
So it might look different after they've washed their hands.
Yeah.
But remember, alcohol-based hand sanitizers don't kill C. diff spores.
Right.
So even if they clean their hands, those spores could still be there.
Okay.
And the last thing is that they only sampled hands, not clothing.
Oh, okay.
So clothing could also be a way that C. diff is spreading.
Makes sense. So what are the experts saying about all this?
Well, Dr. Michael Rubin, he was the senior author on the study, and he said that healthcare providers need to really focus on infection prevention,
Okay.
like using personal protective equipment and practicing good hand hygiene,
Yeah.
because those are the things that can help stop these hidden transmissions.
That's like exactly what the study found.
Yeah, exactly. And the study itself concludes that there's really strong evidence that surfaces and hands are involved in C. diff transmission,
Okay.
and that it's happening way more than we thought.
Right.
And some experts are saying that we should try to follow patients after they leave the hospital
Okay.
to see if maybe they develop an infection later,
Okay.
because some of those transmissions might not show up until after the patient has gone home.
Oh, that's smart. So what should our listeners do with all this information? What's the takeaway?
It doesn't matter if you're a healthcare worker, a patient, or a visitor. We all need to try to prevent the spread of infection.
Yeah.
And that means washing our hands
Always.
and being aware of the surfaces that we're touching.
It's crazy that such simple things can make such a big difference.
I know, right?
Yeah.
And it makes you think, if C. diff can survive for so long and spread without us even knowing it, what else is out there?
Oh, wow.
Like, what other infections might be spreading in the same way, and what kind of research do we need to do to figure that out?
That's a great question.
Yeah, it's something to think about.
Yeah.
Thanks for having me.
Absolutely.
It's been fun.
Yeah, this was great.
All right, see you next time.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.